you're in the right place. Dr. Kris Wusterhausen has been in your shoes, and he's done the work and can show you how you can turn things around. In this podcast, he'll share his personal stories and advice on how to create the life you want for yourself as a provider and as a business person. You'll learn how to reclaim your life, your time, your energy, and most of all, reclaim the dream you had when you started your journey to become a doctor. Welcome to the Dr. Kris podcast. All right, welcome back to some more conversations with Dr. Kris. Dr. Kris Wusterhausen of the Research Clinic out of Weatherford, Texas. He's the doctor that I guess makes medicine easy to understand. How are you, Dr. Kris?
I'm good. We're back from the holidays. We're getting caught up, but life is good. The weather is beautiful in Texas. I'm sure even up in Amarillo. So that's a good thing.
Oh my gosh, it was beautiful yesterday. The wind was still, the leaves were just laying there, looking beautiful. It was a beautiful day yesterday.
Yeah, hard to believe we're about to go into December.
Mm-hmm. So we've been having this great conversation with a little bit documenting your journey into what we would call functional medicine, or the practice of medicine where the patient and the doctor work together, that both sides take ownership, and that we're talking about a change in lifestyle. We're talking about a different expectation of medicine other than just a pill a day, and let's not think about changing anything else. And this journey started with you like going, hey, I don't like how I feel, and I don't like how my practice is going. And it's kind of a parallel where you made changes on both sides to get where you are now. And I think it all began with a discussion around hormones. And I think a lot of people don't think about hormones, and that it's kind of the basis of, as we age, everybody's familiar with low T. We've seen those commercials, but we don't realize that even as far as a female too, that this is an area, one little lever that can be leaned on and make a big difference.
Yeah, and even though now there's a test, I always joke, but if you listen to terrestrial radio for more than one commercial break, you're going to have a hard time not hearing a low T commercial. At least here in the Metroplex, that's the way it is. But even despite how much exposure we get to low testosterone with marketing and things like that, we're still vastly, most men and women who are of the age of hormone replacement still are not undergoing hormone replacement. I haven't seen the actual stats, but it's still a very small percentage of people who actually get their hormones checked and replaced. And as I used to tell my patients, whenever I do tell my patients, when I was in traditional family practice, I did not even check hormones routinely in patients. It would only be when somebody'd say, hey doc, I'm not feeling well. Would you check my hormones? And it'd be like, oh crap, what am I going to do with this? And most of us are trained, by the way, what's normal for a male? 300 to 1100. The difference between 300 and 1100 is night and day. But if you go by the old textbooks, you have to be under 300 on 2 occasions in order to replace a male's testosterone, which, God, that's horrendous to have to be that low before someone's willing to step in and actually do something. That would be like your kid's struggling in a class in school and like, well, we'll get you a tutor when you actually have a 40 average, but you got to get to 40 before I'm going to get you a tutor. Like, you would never do that in any form of life where you make someone become that miserable before you actually do something about it. But with that being said, we don't, most women accept that menopause is just something that you have to go through and something that you have to deal with, which menopause is the complete lack of estrogen production, and which most of the time lack of testosterone goes right along with that. And estrogen itself has been really portrayed as this dangerous negative hormone, and which is completely false. So the study that came out now, gosh, I'd have to look and see how many years ago. Was it 15 years ago? By the Women's Health Initiative that basically said that estrogen is bad for you was completely inaccurately. The conclusions they got out of it were completely inaccurate. When they went back, actually, the presenters of that article actually later had to come back and basically say, sorry, we got it wrong. But most doctors don't know that there was basically, they pulled that study back because they said the data, we didn't interpret the data correctly. Oh my God, we're so sorry. Estrogen is good for you. And oh, by the way, if you use bioidentical estrogen, which it's really good for you. And what is bioidentical estrogen? So, the studies, and I do not recommend animal-based estrogens. The studies that were done with estrogen back in the day were done with Premarin and Prempro. And Premarin and Prempro is equine estrogen. They literally collect the urine from a mare, extract it, and then give it back to you in oral form back to a female, a human female. And as I always joke in my slide set, I have a slide that actually has, I may have told you this before, Steve, but I have a veterinarian who's about to give a mare a shot of human estrogen. And there's this little, bubble over the horse's head going, you're going to inject me with what? But most women today still take equine estrogen, and equine estrogen is not bioidentical. It's not remotely identical to human estrogen. So you're going to see more side effects, of course, with something that's not identical to what they have. But as I always try to tell my ladies who come in and they sometimes start the conversation with, I've got breast cancer in my family, and if I take estrogen, I'm going to get breast cancer and I'm going to die. And actually, the studies recently have shown that with subcutaneous bioidentical estrogen placement, that's pellets with testosterone, they lower their chances. There's 2 large studies now. They lower their chances of breast cancer by 40%. Lower their breast cancer chance by 40%. So I always go, you're actually just like male prostate cancers, higher in low testosterone males. So guys are like, so with the guys, I try to make sure they understand that testosterone causes no form of cancer. It actually only is affected a little bit. Testosterone can affect prostate cancer minimally, but you have a higher chance of prostate cancer if you don't take testosterone, if you have low testosterone. So you kind of got to work their way through that. And then with the females, we're actually lowering their chance of breast cancer. We're making their bones stronger. If we go back to what I always preach during our talks is what's going to take most of our ladies down. It's going to be, they're going to become a frail little lady if they're not careful, because most women don't carry enough muscle. Muscle is the currency as we age. And they're also going to have brittle bones. Well, what's a great first start onto giving them more muscle and protecting their bones and building their bones back? Testosterone and estrogen, bioidentical testosterone and estrogen. So not only are we going to make that female's hot flashes go away so that she's not miserable, and as some of my guys say, not so bitchy, their mood's going to be better. They're not going to be miserable. Hey, maybe they actually have a libido at 55 versus no libido. I cannot tell you how many times I've had ladies tell me, I love my husband, but if he never touched me again, it would not be a bad thing. And I'm like, that's not normal. We can make that go away, but bring that libido back and have a decent sex life. But we're also lowering their chance of dementia. We're raising their bone density, so we're lessening their chance of frailty and sarcopenia and falling down over the garden hose in the front yard and breaking a hip. Because what we know is with our seniors, when they break major joints like a hip or a pelvis, they're never the same ever again. Now, maybe you get them back to 90% or so, but many people never recover from the hip fracture. They can literally tell you, my life changed the day I fell and broke my hip. Why did they break their hip? Not enough muscle, not enough bone. Now, of course, if I get ran over by a bulldozer, I'm probably going to break some things, but that average fall that many of us can experience, you're going to make it through that okay. And so those are just some of the minor reasons why patients should short term going to feel better, going to have more energy, going to help with our, metabolism and body composition, long term lowering the chance of these chronic diseases. And I think that's the part of this that gets really undertold is we're not just doing this for short-term wins, we're doing it for long-term wins as well.
Tell us about your personal experience when you realized that you might need hormones, then you looked into it, then you started taking it.
Yeah. So, again, I was about 33 the first time that I diagnosed myself with low testosterone, which at that time I didn't fit the criteria. I was 320 total testosterone, which we now know that we should be treating those guys way before 320. But that was my testosterone level at 33 years of age.
That seems so young.
Yeah, well, I mean, for different factors, who knows where my testosterone level was when I was younger? Maybe I was 500 or so, and that's why I always try to get my younger patients who are like 20 something to get a hormone panel on them, just for recording sake. Like, okay, I know now that Jeff at 25 is 650 total testosterone, so we can do a comparison, maybe in 10 years and see where they're at. Can be really valuable. But as I've said before, I didn't really know how to treat my own low testosterone. I had a couple of colleagues, prescribe me some things, and we weren't dosing it. Looking back, we didn't know what we were doing, but we were doing the training that we were taught in medical school. And not only myself, I didn't get any results, but also my patients that I were even my male patients, I was like, I got so frustrated because I would do something with them. They would come back in a month and their numbers just never really changed. They never really felt any better. And that's what caused me to go find extra training in this. I said, man, I'm missing the boat here. Somehow, some way, I'm not doing this right. So that's whenever I became a patient and a physician for Synergenics, which, becoming a patient, they dosed me correctly, showed me how to do it, but then also taking their physician training over many months, I actually learned their way of doing hormone replacement. And through my career over the last 12, 14 years, I've learned multiple different providers' way of doing hormone replacement. There's no one way to do it. And constantly learning when it comes to hormone replacement, because there's always tricks to the trade to learn. But then when I got my dose correctly, it was amazing. I mean, I felt better within 2 weeks. I wasn't falling asleep on the couch at 6:30 p.m. any longer. The body fat started to fall off. Of course, I also started working on my diet, because part of that training was teaching me actual nutrition, which I've told you before, I didn't know what I was doing with nutrition before that. Although I do subscribe to a different model of nutrition now, but at that time it was at least way better than what I was doing. And I started to see the results very, very quickly. And that's the great thing about males. Males typically, if they're truly low T, you get their T right, they're going to see results very, very quickly within a month, and they're going to be believers. Women can sometimes take a little longer. I always say there's a reason why our wives and girlfriends are more complex than us. You give a guy testosterone, he feels like he's shot out of a rocket. He's great. His libido goes back to normal. He's sold. Ladies, I always say, give me 3 to 6 months to change their life. Guys ask for a month to change their life. But yeah, so I very quickly saw the results. I lost, within 6 to 9 months, nearly 40 pounds. And, very quickly was doing quite well. Went from 36% body fat down to under 15% body fat. And, really haven't looked back. And that's what started my journey. That's whenever research basically was thought of and formed, was like, well, unfortunately, so the traditional family practice clinic that I ran for many years was the local county clinic. And I quickly learned that the only way I was going to be able to do what I wanted to do was in a cash pay practice. And I just simply wasn't going to be able to enact my hormone replacement, age management medicine, functional medicine model in that clinic. So I very quickly learned that I had to birth research as a different practice in order to cause the transition, which thank God I had to do it that way, because if I could have coexisted, I'd probably still be in that setting, to be honest with you, because I have a hard time making changes. And so, it was probably to my benefit. At the time, it seemed to the detriment, but probably ultimately was to my benefit.
That's where the name research comes from.
Yeah, sort of. If we're really telling a story, we had another name to start with because we were Envy to start with, and then whenever we moved into our new location, which I always like to say a year ago, which now I think it's like 4 years ago. I can't believe when it's been. I mean, that may be wrong too. It may be longer than that. We kind of went through because we really started our practice more female driven, because I saw a niche there for treating females' hormones. But now, obviously, we are, I'd still say we're about 60-40 females to males in our hormone practice. So research was slowly born over a few years there, and that's where we're at now.
You started experiencing the benefits of getting your hormones correct and what a difference it made into you and seeing the long-term impact that it would offer you. Your wife has a similar journey as well, no?
Yeah, well, so she would, I think that if I were to tell her story, and she probably could tell it better, but, she started on testosterone replacement probably around the age of 40. We're both about to turn 50. Maybe 39, 40. She didn't do any hormones for a while, for the first few years, because she just didn't need them. And then she did testosterone only for many years because of lack of energy and gaining maybe a little bit of fat around the midsection that she didn't like. Maybe to just, mentally feel better, sleep a little better. And then I always tell the story. So she's literally about 3 months away from being 50. I'm sure she loves me telling that. And on our 48th birthday, I walked in. It was during the pandemic because she's late March birthday. And I found her with her head poked into the freezer. And I said, "What in the world are you doing?" And she says, "I know you think I'm lying, but I think I just had my first hot flash." And women who've described, luckily you and I will never experience a menopausal hot flash, but they say it feels like a wood match, that you light it and the red, that the head of the match, when it lights up, it's in your chest and then it dissipates to your head and goes away and all lasts like 10 seconds, but supposedly pretty damn intense. And I had to believe her when she had her head in the freezer. And sure enough, checked her labs the next day. And sure enough, she was menopausal. Average age of menopause for a female, 48 to 52. So she nailed that 48 right on the dot. And so the good news for her is we checked her labs routinely. So we knew that she had not been menopausal for hardly a very long time at all. And I put her on estrogen replacement. And this is where my education comes in, and some of the people that impact me. I was always kind of taught lower doses of estrogen. You don't want to go too high, these sorts of things. So I put her on a very low dose of estrogen, and she came back to me and was like, "I feel better, but I don't feel like I did 6 months ago. I still don't feel like 6 months ago." Checked her labs, like, "Well, your labs look good. You really should be okay." And I really kind of blew her off, to be honest with you. Like, "Oh, it's just going to take another round." And we did that a couple of rounds. And then through I've become really good friends with Dr. Uzi Rice, who is the estrogen king of the West Coast. And he's the one that started really, truly showing me the studies and training me that these women need higher levels of estrogen. Like, what are we afraid of? They had way higher estrogen levels when they were teenagers and 20 somethings and 30 somethings. Like, why are we scared of giving them estrogen? And so with Crisanta, I started increasing her estrogen up to where she felt good at. And within a couple of doses, we were able to get her back to where she's like, "I feel normal again." And it just teaches us as practitioners to quit always using lab data as our determining factor. Let your Yes, use labs. I'm not by any means advocating a practitioner not to do labs, but they're not most of the time the most important thing. It's how the patient feels. As long as you're using bioidentical quality hormones, not all of us need the same exact levels, and we have to break that mold. This is why it's called precision medicine. Is, what's right for Steve may not be right for Kris. What's right for Chrysanthemum may not be right for Mary. And so over the last 2 years, I've done a much better job of listening to my ladies. How do you feel? Oh, I feel great. Okay, then this lower dose is perfect. You know what? I don't feel great. My libido is kind of crappy, and I'm having a little vaginal dryness, or my mind feels foggy. Well, okay, well, let's try going up a little bit. Let's see what's the worst case scenario here. We'll go back to this dose if we need to. So I hate to say it, but I always tell my staff and definitely my wife that they're kind of our internal guinea pigs to basically try things. But here I am, been doing hormone replacement for 15 years, and I'm learning things recently. I'm having these myths busted. And I always tell patients, if you ever want to get over your fear of estrogen, just go Google Uzi Rice and listen to him for about 20 minutes. He'll ease your fears. Here's a man that's been doing estrogen replacement for 40 to 50 years and has had no increased incidence of breast cancer. No, he's had 0 cases of dementia in his practice. He's a huge advocate by how you prevent dementia is just don't ever lose your estrogen in females. So some amazing stuff. And that's why we think that so many more women get dementia than men, because of estrogen deficiency.
So you and your wife are actually living this and experiencing it, and then you started to implement it in your practice. So not only did you have a change in your health personally with you and your wife, but you started to see a change in the health of your new practice as well.
Yeah, sure. Yeah. Cause I mean, again, we learn off each other. We constantly go to lectures and conferences and learn from other doctors. And, if this is the right field of medicine for providers, if they want to continue learning. I mean, as Uzi tells me, he's in his 70s and he goes to lectures to learn. He's in his 70s. I mean, if he wanted to, he could just, do what he does and not learn another thing and finish his career off and be just fine. But why do that? As he always says, that's boring. Why would you want to not learn more? Why would you not want to help your patients more? Don't be that doctor that gets, cemented in their ways and they just can't, they feel like it just is the way it is. I'm so blessed to be surrounded by such good physicians, not even just physicians, providers. There's some fantastic nurse practitioners and PAs out there that are doing circles around some doctors just because they're really putting in the time to learn these things. And so just, it's really important. And then, so who gets to benefit from that? Well, the patients do. They get to benefit from that. They get to have providers that, are really up to date and who are learning. And as we always tell our patients, and you've heard me say before, what I tell you today, I may tell you something different next month because we've learned something new, and patients get excited about that. They're like, oh my gosh, new information. I love it. Because my patients are looking for that as well. Sometimes my patients bring me things and I research it and like, oh, you might be onto something here. So, it becomes a two-way street versus a one-way street.
You mentioned in a previous conversation, there are practices that are just hormone replacement practices, period, correct?
Absolutely. Yeah. Yeah. And I think that's can be great. I mean, I've mentioned to you before, a couple of things. I think you can do too much. Sometimes, and I just had a conversation with one of my colleagues' wives this morning about that. They're really wanting to branch off into some other stuff. And I was just giving her maybe some cons to that, like y'all are really good at what you do now. Like, do you really want to diversify in that way? Is it your passion? If it's not your passion, don't do it. If you're doing it for money, it's not going to work. Do it because it's a passion and it'll make money, then that's fine. But if you're a practitioner and you're wanting to start up a business, the great thing about hormones is it's fairly low overhead. You really, for the most part, only spend money when you do the procedures, because what really gets you turned upside down in practices is overhead. You go in and you buy these machines, and these machines are all 150,000 a piece. And guess what? They all have notes every month. And versus really looking at things that you kind of pay as you go types, nearly layaway type programs where like, okay, I'm okay with paying that because I've already seen the patient. I've already made some money and it's profit. And so that's why I always think, I truly believe that the two things that are going to help the three things that are going to help the patient the most, and two of them don't cost a lot of money, is exercise and nutrition. If you as a provider can learn how to have a good conversation with your patients on nutrition and exercise, you're already light years ahead of your colleagues. And then three, you mix in hormone replacement. Still today, 80% of what I do is based on nutrition, exercise, hormone replacement, and maybe some supplements. And again, all those things have low overhead. You can train those things. You can learn those things. Providers can go to conferences and hopefully within a year or so feel comfortable doing those things, and start a practice. And you know what? Your practice probably will flourish, and you may never feel the need to add anything else. And there's certainly nothing wrong with that. Typically what you find in a practice though, is as you do hormones and a little nutrition counseling, and like we have a little extra, we have not a little, we have a personal training gym in the back. Well, then you find interest in things like peptides and things that you actually enjoy, and you can expand upon that. But just be careful, do things that you love to do. That I think that's what I've learned over the last decade is if you add things just for revenue only and you don't really believe in it or love it, it's probably not going to work out the way you want it to.
Yeah, I'm just seeing the pattern here is like accepting and making a commitment to a lifestyle change, both as a practice, but expecting that of your patients. And that's why I really like this conversation, that there are people out there that want to take ownership and partner with a physician to change their lifestyle. They get that. They're rejecting seems like we're just programmed the other ways. Like, don't change your lifestyle, just take another pill.
Yeah, well, that's, I think I've said that to you before, is that, I felt like when I was doing traditional family practice, all I was doing is like, well, now it's time for the next medication. Even though we just added one 6 months prior, like, oh, it's time for the next medication. And what was crazy is patients are just so accepting of it. Like, oh, okay, all right, another medication. You get a handful of patients that kind of fight it, but for the most part, they're like, okay, I guess that's just part of getting old, isn't it? Take more medication. Like, no, that's not true. But I was programmed to think that's just the way it was as well, that it was just impossible to get patients better. And I mean better. I mean, somebody that drops 10% body fat who we had a customer just walk in this morning that's lost in the last 6 months, I think he said 38 pounds. And what's he doing? Hormones, exercise, and some nutritional counseling that we gave him. Nothing crazy, and some supplements, nothing exotic. He's not using peptides or any of these other things. I mean, a really bare bones program that's working perfectly for him. And why would I change it? It's working perfectly. He's like, it's the best I've felt in 10 years. So, I mean, these are things, patients can get better. Just, it's so sad that we just, as a country, have given up, on getting better. We think the United States medical system is great, but it actually sucks. There's a reason why we're, when you look at the stats of countries and their medical care, America's down the list. And it's because of how we practice medicine. That's all it is. If we could actually empower our doctors to have time to be with their patients, if we were able ever to figure it out with the insurance companies on how a doctor could spend 30 minutes with a patient, instead of seeing 35 patients a day, he sees 15 to 18 patients a day, but does quality medicine, you would see such a difference long-term and how much money is spent. But good luck ever talking the insurance companies into that. They're just, no one wants to be the first company to try that. But I think it would obviously work. But yeah, patients are looking for someone who will take the time to listen. I think the biggest thing as a provider that I can tell other providers is just listen to your patients. Just shut up for a minute and let them talk. it's very powerful just to let somebody be heard. You know, when we're in that 12-minute circus of traditional family practice, you know, I found myself cutting my patients off because I just didn't have time to listen to them. And, you know, you feel like you already know where they're going and we already know what to do. Like, Steve, I don't need your input right now. You need this medication and I already know it. And, you know, and I caught myself starting to do that more and more. And I just didn't like that personality of myself, of where I was not letting my patients talk. Now, don't get me wrong. Sometimes you're like, enough already, but anyway, for the most part, just let your patients tell you. That's why we're like, you know, what are your goals? You know, new patients, and I just shut my mouth and let them talk until I feel like they've gotten to the end of their story. And usually it's only like 3 to 5 minutes. Somebody just wants, you know, I really just want to feel better. I want my life back. I don't want to be so sad when I look in the mirror and see this belly and, you know, things like that. So, yeah, so it's just listen to those patients and they'll take you down the path with them.
Seems like in this change that you made both in your personal and your practice, that if you think about the long-term benefits for your patients, your practice, and your personal, kind of talk to us about what are the guy you talked about that came in this morning, what have you just set him up for the next 5-10 years to avoid? What have you?
Yeah, that's a great topic.
Yeah.
Yeah. So, I mean, you're taking that guy's chances of having true chronic diseases and you're lowering them tremendously, because what we know is, let's just take body fat. And especially us guys, we mainly put that body fat on our bellies. We get that visceral fat. Okay. It's what we try to measure in our practice with our scanner is visceral fat, that fat around your organs, especially like those guys, you know, that we always say the beer belly, like their skin is tight. Like if you were ever to touch their belly, they don't have a whole lot of fat above the dermis. It's all below the dermis. It's around their organs. It's the most dangerous kind of fat you can have. And as guys, that's where we like to put it. You know, I always joke, even when my body fat's like 14%, it's still right there in the middle. It's like, God almighty, there's not an ounce of fat on me anywhere but my belly. And that's just where my body likes to put it. So it's super hard to get rid of. But what we know is that belly fat, especially that visceral fat, raises inflammation in the body. Inflammation is what causes cellular dysfunction. Inflammation is what leads to chronic diseases down the road. It makes you a much higher risk of heart disease, cancer, strokes, diabetes. You know, it's a fact. It's not, you know, I tell my guys all the time, if I don't get this belly off of you, you're gonna have chronic diseases down the road. Or let's change the scenario and they already have some chronic diseases. If we can get your fat under control, we can get you off medications, but B, you know, stop these things and even reverse some of them. You know, there's some studies out there that showed people who get gastric bypass and they lose 80% of their medications if they have gastric bypass. Why is that? Well, because they're losing fat. I mean, you know, I'm a simplistic person. If we're a half-ton pickup, we can't put a ton in the back of the truck and drive around for the next 10 years and expect everything to work correctly. We're complex, but we're not that complex. We're built for a certain weight and body fat, and that's where we should be. And inactivity and the horrific overall American diet is what's killing everybody. Sugar is the main thing in that diet. And as I tell my patients, we don't need to add sugar to our diet to exist. It just does not need to happen. So if we can keep that, get some intermittent fasting going, keep their sugar intake down, get them off the sodas and the alcohol. You don't have to have that perfect diet, just a reasonably clean diet, and you can get tremendous success with the hormones and with the exercise.
Let's talk about your practice then. You've just extended the profitability. You've just changed from running on a treadmill, it seems like, to having choices, to having options.
Well, the biggest thing is you'll enjoy what you do. And so many doctors, high suicide rates, not as bad as dentists. Dentists are the worst. As my dental buddies say, try looking in a mouth all day long and it'll make you want to kill yourself. I guess that's true. But the physicians are right behind them in suicide, professional suicide rates, occupations, burnout. So many physicians are retiring early these years, not because of money, because they're so fed up with the medical field. I was having a long discussion last night with my daughter. My daughter's a sophomore. She's I'm lucky enough that both of my kids are really smart. My daughter is extremely academically gifted, and she's had thoughts of being a doctor. So I had these discussions with her. I'm like, I wouldn't, if you want to be a traditional doctor, I can't tell you I recommend it. It's only going to get worse. It's not going to get better. I mean, I hate to see what it's going to look like in 15, 20 years. If you kind of like, because she works in my office in the summers and sees what we do, and she goes to the conferences, and she doesn't go to the lectures, but she gets to hear these fireside chats, having a cocktail in the evening by the fireplace. I'm like, if you really think what dad does is kind of cool and you want to continue that torch on, then go become a doctor. Be a doctor if you really want to be a doctor. I'm just saying, make sure you know what you're getting yourself into. So I think when providers make these changes with their practice, if you truly love it, that's the biggest reason to make the change. And then, yes, we're the amount of patients I have to see a day is tremendously less than what I had to see back in my traditional medicine practice. Again, we had 4 providers and over 20 something employees to keep that clinic going. We have 2 providers here, and, I need 3 or 4 staff members to keep that going. So just your overhead is so much lower, and per patient is obviously higher, and it's cash money. So, you do a service, you get your cash, and you move on down the road. So there's a lot of benefits to it, but I just think the biggest benefit is enjoying what you do, seeing success with your patients. My patients are happy. I probably told you this before. Most of my family practice patients, they liked me. I know they did, but they'd come in and just unload on me most of the time. I became feeling like I was depressed because I felt like I was taking on everybody else's worries and fears and depression. And it was just like, oh my God, like, can I get one patient today that's in a good mood and, is doing well? And, here it's the exact opposite. It's like, oh, today I had that one patient that was flustered or frustrated, or I needed to spend an extra 15 minutes with them to kind of push them down the right path. We just don't have that anymore. I used to joke, like, my staff is a little spoiled at times because most of our patients are so nice and they're so appreciative of what we do. And just like any business, occasionally you get that upset patient. They call, they're about whatever. They've had a pissy day and they're going to be pissy with you, and they get all flustered. I'm like, hey, ladies, I'm not excusing what they did, but that was like every 15 minutes at my old clinic. Like, and that patient would still be pretty low on the totem pole of being upset. It was just constant chaos. And then as your staffs are bigger, any doctor that does this will tell you, when your staff gets bigger, there's just more chaos and infighting. And I am joking, but try, being 1 or 2 males and 20 something females. It was just always something every day. And so I really like having a small family-like atmosphere with my practice and my staff. And I genuinely, truly care about and love every person I work with. They're just great people, and they choose to be here. They're not just doing it for a paycheck, which I think is awesome too.
Would you agree that part of your fulfillment of running this type of practice is the autonomy that you have, that being able to make decisions that aren't dictated to you by insurance or other just ridiculous compliance stuff?
Yeah, I can absolutely say I don't work for insurance companies. And so, I get to pick what I think is best for the patient. If it does cost money, then we get to discuss what it costs. And then I'll tell them if I think it's worth it. And most of the time my patients go along with me because they know that I've got their best intentions at heart. And I don't take lightly things costing money. I always tell them, and how I truly feel about it. Would I spend the same amount of money on that test? And if the answer is yes, then I recommend it. If I'm like, then maybe we don't. But yeah, the autonomy of just to be able to truly do what's best for your patient is amazing.
Excellent. Is there anything else that you would, if I'm a physician and this is like really intriguing to me, I'm a provider. I'm just at this point where I need to start making some moves to a different place. What are some things that you would recommend?
I still go back to the same thing, which is start getting education. You've got to start. You can't make a lateral move or a different move unless you know what the heck you're wanting to do. So it's all great to hear me say, this is what I love. Maybe that is what you'll love. Maybe it's not what you'll love. You need to get out there and get the education. You need to, SSRP, A4M, AMMG, those are some different entities. Obviously, I'm very partial to SSRP because I'm a faculty member there. You've got to get out and get educated. You got to figure out what it is that you want to do with your practice, your life, what you have passions for, because what I have a passion for may not be what you have a passion for. And again, I've already said it a few times in this podcast, but that's the biggest thing I've learned over the last decade is if I do not have a passion for it, I can't sell it. I'm not going to get results and it's not going to work. So it has to be a passion. So they need to figure out, those providers need to figure out really where do they want to be in 10 years? And then pick their business model, get the education, and then set the motions in action to get it done. It ain't going to happen on its own. You can't sit on the sideline and just think that it's a new practice is going to fall in your lap because it doesn't work that way.
All right. Well, this is an excellent series of conversations, and this is about providers and patients working together, making a decision and a commitment to a lifestyle change and doing things that have a big impact on the fulfillment of your life, your being around, being present for your family. This is a serious topic.
Yeah, absolutely. Absolutely. And that's what we hope we can do with anyone listening is help them on that journey for themselves. Every journey is different and we can help them with it.
All right. Well, we'll wrap up here. So if you want to reach out to Dr. Kris, what's the best way that they should connect with you?
Well, first, going to the website is probably the easiest way, theresearchclinic.com. They also can reach me at Dr. Kris with a K, Kris at theresearchclinic.com. But we have information on our website of how to contact us and how to find out what services we perform. And we can certainly reach out to them if they leave us a line.
Yeah. All right. Well, that's a wrap. We'll pick up the next conversation. I think we're going to talk about some other lifestyle changes that we should consider and why.
Excellent. Sounds great.
All right. And that's a wrap. Thanks for joining the Dr. Kris podcast. If you learned something today and you want to connect and get more information, visit our website, www.drkris.life, where you can find more great information or even schedule a time to learn how you can engage with Dr. Kris. Be sure to follow, like, share, and we'll see you on the next episode of the Dr. Kris podcast.